Everyone here for our
Sandy,
presentation
you
on
froze on
acupuncture.
us.
And Larry,
Or
would
did
you like to do
everybody
a little
freeze?
introduction about Amherst Neighbors? Larry, oh, he's frozen. In any case, it's our pleasure of Amherst Neighbors to have Dr. Jonathan Klate here. Um, he's going to give us a talk on acupuncture. I've known Jonathan for many years, and recently I was actually a patient of his. I had a severe inflammation of a tendon. I went to 4 or 5 different specialists and I got no relief. And my personal care, my physician said, "Why don't you go see an acupuncturist?" And I said, "Well, that's a great idea." So I went to see Jonathan. And as I was laying there with all the needles in me, I was saying, "Wow, this is really working. I mean, this has been a great experience. This would be a good topic for Amherst Neighbors." So it was then and there that I contacted Jonathan in his office, and he graciously agreed to join us here. Jonathan has been practicing acupuncture in the Valley, believe it or not, for over 50 years. He's followed in the footsteps of his father, Dr. Reuben Klate, who was also an acupuncturist, and he has introduced acupuncture to this region in 1978, and he has practiced continuously since that time. So I think we're very fortunate to have Jonathan here, and I will turn this over to him.
Well, thank you, Sandy. Thank you, everyone, for being here. Let me just make that correction. Anybody here who still does math understands that I can't both have been practicing in the Valley for over 50 years and been here since 1978. But this is my 50th year in practice, but I began my practice in Cambridge, Massachusetts, and I moved to the Valley in 78. So I've been here continuously since then. But thank you and welcome, everyone. It's really I who am privileged to have your attention. I rarely do public talks anymore. It's been quite a number of years since I have. I used to do them frequently, all over the Valley, all over the place. And but I practice in a much quieter way now than I used to. So I did have to contemplate a little bit after Sandy offered me this opportunity. And then I agreed. So I would say right away, I'm certainly not looking for new patients. I am very much in a flourishing practice, but it's filled. At this time, I can see new people on occasion, but I'm not here with any kind of solicitation. I'm here because it's my pleasure to speak to you, my friends and neighbors. I did come to the Valley in 1978. At that time, there had never been an acupuncture practice in Western Massachusetts or in the states of Vermont, New Hampshire, Connecticut, Rhode Island, or Maine. The only people in New England were my very few colleagues in the Boston area. The only person practicing acupuncture in New York State outside of New York City was my father, who was in Westchester County at the time. So when I decided to move here, for reasons that many people move here, because it's so beautiful here, because there's no place else I'd rather live, which this springtime shows us again, with all the flourishing here, with all the unspoiled land, with all the farmland, and yet with all of the academic institutions giving us such a lively life of the mind and creativity and life of the arts. That's why I moved here. But nobody knew what acupuncture was, what it was for, how it worked, what it could be good for. And so I was invited to do grand rounds at the local hospitals and the local medical centers, and I did public talks and gradually attracted a practice. And now acupuncture is flourishing in New England and throughout the country. There are hundreds of acupuncturists in New England now, tens of thousands in the country. It's a fully licensed profession. None of this was so in the 1970s when I began. I will offer you the opportunity to ask any questions that you want when I've gotten tired of listening to myself talk. So at the end, in a little while, after I speak to you about acupuncture and Chinese medicine and what it is and how it works and where it comes from and so on, various theories, then I will invite you to ask your questions. The only thing which I discourage you from doing is asking questions about your personal health. But if you're determined to do that, I will have to ask you to take off all of your clothes and remain on camera so that I can examine you remotely, and then you can ask your question. But other than that, please don't ask about your personal health. The other thing I will request, and I can only request it because this is the Zoom universe and everyone is an individual with full rights to do what they wish. When I do a Zoom presentation, I love it when people are willing to have their cameras on so that I can see you as you can see me and have some idea of how people are responding to what I'm offering. So please turn your camera on if you will, and if you prefer not to, then that's really up to you. So, acupuncture and Chinese medicine. Chinese medicine is an entire theory and system of medicine, of which acupuncture is a particular modality, along with other approaches that I'll also be discussing. But before I speak about acupuncture and Chinese medicine, also you see that I'm out in space here. Yes, just I prefer you don't see the disarray of my personal study right now. So I chose the cosmos as a backdrop. But we really are out in the cosmos. I was just watching something yesterday, which said that, there are over, I think the number is 3 billion stars in our Milky Way. 3 billion stars, 3 billion suns in the Milky Way. And that if you take a patch of sky as seen with the naked eye as the size of the full moon, so a tiny part of the arc of the sky, and you look at that with the Hubble telescope, you can see 1 billion galaxies, each one the size of this Milky Way. So I hope you are awed by that as I am, that this is where we are, so special in this universe. And that's maybe partly why I've chosen the cosmos backdrop. So I'm going to begin this history by talking about a discovery about, I think, 25 years ago or so now, in the high Alps of Italy, not in China, where the remains of a Stone Age hunter were found frozen in the ice. And I wouldn't be at all surprised if some of you remember this discovery. It was remarkable. Due to climate change, the glaciers are melting, and they found this person who was remarkably well preserved from 5,000 years ago, who had been fast frozen, now thawed. This body was quickly removed and brought to an institute in Switzerland where it still is. And this individual was so well preserved that the various forms of pathology which he had stomach ulcers, he had arthritic joints, were present and able to be assessed. And he had around his neck a leather pouch which had some herbs in it, which we know today are useful in treating the symptoms that he had. He also had a great number of tattoos. And as acupuncturists examined these tattoos, it was learned that many of them were on the acupuncture points that we know today are useful in treating the symptoms that he had. And this is not in Asia. It was in what is now Europe 5,000 years ago. Acupuncture is really a feature of a world medicine. But whatever this individual's tribal wisdom was 5,000 years ago in what is now Europe, that understanding was lost, so that his people knew things, some of which are not even known today in contemporary Europe. China had particular characteristics that have existed only in China in world history. which allowed the system of Chinese medicine and many other systems of knowledge to be cultivated and to flourish. It has a 5,000-year-old continuous history with a written language and books and libraries and a continuous civilization, so that knowledge which was discovered could be written down and preserved and passed on to be further developed and elaborated upon from generation to generation. And it's an unbroken history. There have been many different forms of government, of course, obviously, but the Chinese today trace their history to the people who built the Great Wall. In Egypt, for example, we had an ancient civilization that built the pyramids, but that civilization vanished. And there were about 1,500 years of history of which we know very little between the Egyptian civilization that we do know historically, that's about 3,000 years old, developed again in the Nile Valley. Which is why, for a margin note in contemporary geopolitics, Taiwan Island has been part of China historically. It's been separated at various times in warring states periods, but it's a part of China historically, and the Chinese have this 5,000-year-old memory, and I have no doubt, as most of mainland Chinese have no doubt, that Taiwan will be united with the mainland. Again, I'm not advocating that. I'm not denigrating the wishes, the understandings, and the safety and the good fortune of the Taiwanese people. I'm only suggesting that in terms of the panorama of history, Taiwan has been a part of China, it's been separated before, and it's likely to be one China again, to offer you a sense of this great panorama. So when we study traditional acupuncture in Chinese medicine, we begin with the literary tradition from about 300 BCE. So about 2,400 years ago, with a volume called the Neijing Suwen Lingshu, the Yellow Emperor's Classic of Internal Medicine, which is about 1,200 pages long and is a compilation of much older texts. And since then, there have been hundreds of volumes, all based on the observations and the clinical work of Chinese physicians throughout the millennia. When you study traditional acupuncture and Chinese medicine today, that's what you study. You study traditional Chinese medicine, which is a complete and radically different system of medicine than contemporary medicine. Today in this country, it's a complementary system of medicine, but it's not as though there are techniques to therapeutically address conditions of suffering that are applied according to the parameters of contemporary medicine. They're mostly applied according to the parameters, the theories, the clinical observations of traditional Chinese thinking, which is very different from traditional and contemporary Western thinking. And a primary difference is that in Western physics, in the questions of what is the fundamental nature of this reality that we inhabit, we tend to be a materialistic culture. And by materialism, I don't mean acquisitiveness and wanting things. I mean having a fundamental sense that we are material beings, and to understand who we are, to understand the patterns of health and illness, to understand the nature of reality itself, we start by examining the physical stuff of our world and the cosmos. One of the oldest ways of coming to terms with this was the ancient Thracian and Greek notions of a four-element cosmology, earth, water, fire, and air. We're all familiar with this as the irreducible substances out of which everything was made. And now we have the periodic table of the elements, and I've lost track of how many there are, how many different elements, 100 and some odd, out of which everything is composed. The Chinese, for all their brilliance, all their wisdom, all their curiosity, didn't begin their questioning from that perspective. They always asked, how does this work? How do things change? How do they move? And the fundamental notion is the notion of yin and yang, which by now in contemporary culture, everyone has heard of yin and yang. And you've all seen the symbol. And Carolina, if you would put up that slide of the yin-yang symbol, people can see this. You're all familiar with this. You've seen it somewhere. The two little tadpole-like figures together comprising a full circle. In this particular diagram, one of them is sort of an orange or gold color. The other is blue. And you see arranged around them 8 symbols comprised of 3 lines each, solid and broken lines. Those lines are called the bagua. Ba is simply the number 8. Bagua is the 8 trigrams. In traditional Chinese philosophy, this symbol is very rarely presented without the bagua around the symbol. In fact, there's no name for that yin-yang circle in Chinese on its own. It's always called the bagua. It's always presented with the trigrams. The trigrams, some of you may be familiar with the traditional Chinese book of divination, the I Ching. If you take the 8 trigrams and you put one on top of another, you get 64 possible combinations of solid and broken lines. And these are hexagrams, and they're used for divination, which I won't be going into, but I want you to look at that yin-yang symbol. And what you see if you look there is that they are mutually dependent. If you take the symbol that moves from the top around left counterclockwise in that orange light color, and then burgeons, and just as it reaches its fullness, the other circle begins from inside it, the blue circle, moving around counterclockwise, and just as it burgeons near the top, the other circle begins again. You will also see that inside the widest part of the orange circle, there's a little blue circle. Inside the widest part of the blue circle, there's a little orange circle. This is the yin within the yang and the yang within the yin. And this is the polar nature of reality. And Carolina, I think we've looked at that long enough. You can please take that down. Maybe we'll get it back again later. And why is this important? Well, it's important in understanding the nature of health and illness, because the homeostasis of the human state of health can be described in terms of polarities. Things are too moist in the body, or they're too dry. They're too warm, or they're too cold. There's no way to describe reality through observation and escape the nature of polarities. I remember a movie, maybe 40 years ago, some of you may remember, unremarkable comedy with John Denver, the singer, played a grocery clerk who was Oh God was the name of it, who would talk to God. And the character of God was played by that old comedian, George, who was it? That old marvelous comedian. It will come back to me. I'm not sure.
George Burns.
Very good. Thank you for that. Appreciate it. So George Burns plays God. And at one point there's a trial and George Burns is on the witness stand. He's sworn in. He says, I promise to tell the truth, the whole truth, and nothing but the truth, so help me me. And he's asked at one point, why is there evil? And he says, you know, when I was making this universe, I knew we needed warmth, and I couldn't figure out a way to do it without cold. And I knew we needed inside, and I couldn't figure out a way to do it without outside. And I knew we needed good, and I couldn't figure out a way to do it without evil. If there was another way, I would have done it, but I couldn't figure out any other way. Which is cute and clever, but that is the world that we live in. If I say something is up, that is not a sensible statement, not possible to make any meaning of, unless you have an understanding of down. If I say something is inside the body, not a sensible statement, unless you have an understanding of there is an outside of the body. So all of Chinese physics, all of Chinese science began to be based on the oscillation between polarities that we observe in the cosmos and in ourselves. And then when their healthcare began to be systematized, the discussion often became, what do we do when things are too dry in the body? What do we do when they're too damp, too moist? What do we do when things are moving too fast? Say a heartbeat or circulation. What do we do when they're moving too slowly? And the first theories of Chinese medicine have to do with balancing polarities, and we still think in those terms today. Another theory that came along afterwards was a theory that comes to us as the law of 5 elements. But elements is really a mistranslation, because elements translates really back to the Western notion of the components that comprise reality. And as I said, the Chinese never thought of things that way. The 5 elements in Chinese is the Wu Xing. Wu is the number 5. Xing means movements. Are fire, earth, metal, water, and wood. And when the first Christian missionaries came to China and they learned this theory, and it was similar to the theories, the ancient European theories of 4 elements, so it's familiar to them. So they said, well, the Chinese have a similar system of the notion of creation and reality. They just have a system of 5 instead of 4. But in fact, they're not elements, though even I may use that term from time to time, in the sense that we think of the universe as being comprised of these. They are phases of change. So, to examine this in the macrocosm, what we call the year is divided in Chinese medicine in Chinese philosophy into 5 seasons. Well, we have 4 seasons, and the 4 seasons are arbitrary. Of course, we know there aren't really 4 seasons that are conditioned by the solstices and equinoxes. So the Chinese say there are 5. So what would the 5 seasons be around here? Well, the springtime would begin around the middle of February, when you start seeing the sap buckets out on the maple trees. The sun is higher in the sky. There may still be a blanket of snow out there, but the sap is rising. It's awakening the insects dormant in the bark of the trees, brings the songbirds back. There may still be more snow to come, but this is a different season than January was. And the springtime lasts until about now, maybe another week or so. And you know, by the end of this month, all of a sudden there's going to be a 90-degree day, and it's not going to feel like springtime anymore. And this is when summer begins around here, which continues till, around the beginning of August, when we have the season called by the Chinese late summer. Very different from the peak of the summer. And this persists till around middle of September, when it's now autumn, which continues until around 1st of December, when it's winter, which lasts till the middle of February. I always find it's sort of cute when you watch the meteorologist on television and it'll be the 10th of December and they'll say, we're having 8 inches of snow today and it isn't even winter yet. Well, of course it's winter. It's snowing, it's December, it's winter. Winter doesn't come in all of a sudden at a moment at the solstice, or they'll say it'll be 90 in the beginning of June, and they'll say it isn't even summer yet, and it's 90 degrees. It's summer. So the seasonal changes are arbitrary, but these seasonal changes correspond to those 5 elemental phases, the whooshing of wood, fire, earth, metal, and water. And within human beings, so much about us is understood to also move through these phases of transformation. So associated with each of the phases is an emotion. For example, associated with that wood phase, which is associated with the spring, is the emotion anger. Associated with the fire, the summer phase, is the emotion joy. The late summer season, with the earth phase, the emotion is sympathy. In the autumn season, which is the metal phase, is the emotion grief. And in the winter season, usually beginning around December, in the water element, is the emotion fear. We look for all of these emotions to be present and called forth in response to any human experience appropriately. So when a patient comes to an acupuncturist practicing traditionally, among the things we will be concerned with are these. First of all, people tend to present a symptom, as they know they must when they see a conventional doctor. So a patient will come to me, perhaps referred by their physician, and they will say, I have migraine headache. What does that mean? Well, the first job of a physician in today's world is to exchange the description of a symptom that a patient presents for a Latin term. So you go to the doctor and say, my head hurts, and they say, that's called migraine in Latin. What have we learned about it? Maybe something, maybe not so much. So when a patient comes to me and says they have migraine, I don't have a particular treatment for migraine. Although I've received hundreds of patients who present migraine as their problem. I may be interested to know, is there a seasonal component to this? Is their migraine headache tend to be worse in the springtime? Or worse in the summer, or worse in the late summer, or worse in the autumn, or worse in the wintertime? Or is there a time of the year when they don't? I get headaches every time of the year, but I don't get them in the summer. Or I tend to get fewer of them in the winter. And what's the emotional quality within that presentation? If I say, how does your headaches make me feel? And they say, they make me feel angry. They say, they make me feel very sad. They say, I just can't get anywhere near a state of joy or delight when I have a headache. Or when I have those headaches, I get very sad and I say, when did you begin having them? And they say 12 years ago. And I ask them, did anything happen 12 years ago? And they'll say, yes, my husband died. And everyone will present with a particular vocal quality. So associated with that wood phase is a shouting voice. I have migraine headaches. Associated with the summer phase is a laughing voice. I get migraines. I wish there was something I could do about them. Associated with that phase of late summer and the metal element is the weeping voice. I have migraines and they're really such a plague for me. And associated with the autumn and the earth is the singing voice. And they'll just tell me that they have migraines and they get them all different times and all different times of the day. And it's so difficult when they have these headaches. And associated with that water phase in the winter is the groaning voice. And they'll say, yes, I have migraines. And sometimes when I have the migraines, I have no energy at all. Now, attending to the emotionality, attending to the sound of the voice, attending to when this symptoms gets better or worse. I begin to have a sense of how the system is in a state of disharmony based on the constant movement of energy within human beings. Also associated with these phases are colors that appear in the complexion. So associated with that wood phase in the spring is the color green. Associated with the summer and the fire phase is the color red. Associated with the metal phase in the late summer and grief is the color white. Associated with the autumn and the earth is the color yellow. Associated with the winter and the water is the color blue. And now I'm going to ask Carolina if we put that 5-element slide up for a moment, and you can get some idea of what I'm talking about here. So here you see an image of the 5 phases, and you see arrows moving in a clockwise fashion from water, which is there at about 10 o'clock, to wood, to fire, to earth, to metal. This describes the way energy moves and creates itself. So the water generates the wood, which generates the fire, which generates the earth, which generates the metal. The arrows that cross in the middle, from the metal to the wood, the water to the earth to the, the wood to the earth to the water to the fire to the metal. This is called the control cycle. And in the middle, you see that word whooshing, which I offered you, which is the 5 phases. This describes one of the patterns of the way energy moves within people that any traditional acupuncturist, in addition to the yin-yang patterns of inside and outside, and empty and full, and moist and dry, and cold and hot, and so on, we take into consideration when trying to understand the nature of a pattern of disharmony within a human being. So let's take that down now, please, Carolina. And let's put up the final slide, the meridians. So the Chinese identified pathways of what we call qi, energy, which move through the body. And these are all associated with those whooshing phases. So when there is some obstruction of the movement of energy, and there are many more, this is one partial view of the human body, but I could show you lateral views and posterior views and closer up views of various parts of the body. There are many hundreds of these locations that we call acupuncture points or therapeutic loci. When the energy isn't moving as it should be, flowing comfortably in the system, energy is likely to become obstructed one place or another. And the diagnostic task of a traditional acupuncturist is to understand how is energy obstructed and how we can unobstruct it and get things moving again, as they must in order for health to be sustained. So there are many other ways to think about qi. We now know that the qi flow corresponds to nerve transmissions, connective tissue planes, metabolic components carried in the blood, such as oxygen, hormones, neurotransmitters, and nutrients, as well as the functional energies of organ systems, depending on the context in which we use that word qi. And acupuncture has been demonstrated to regulate and improve the function of all these components, which are integral to health. We can maybe say acupuncture seems to grease the wheels of the dynamics of these self-regulating functions. And in terms of physiology and biochemistry, acupuncture stimulates nerves and connective tissue, and it results in profound effects on the nervous system, including regulation of key areas of the brain, which influence all of body functioning. So I think we can take that slide down now, Carolina. And that's why, in terms of a biomedical perspective, The National Institutes of Health has endorsed acupuncture for hundreds of different conditions, which it's been demonstrated to treat effectively. This is when we could trust the National Institutes of Health, when we could rely on it for reliable information. So you can look at acupuncture from a biomedical perspective and understand that it treats this condition and it treats that condition, and it does. But the treatment is most effectively addressed from the perspective of the movement of energy from a perspective of traditional Chinese medicine. So to dial in a little bit deeper, associated with each of those wuxing, each of those five phases, are different internal organs and systems. So, for example, the heart is associated with the summer season, and which makes sense. The heart is often affected by heat. And the heart has a meridian, one of those energy pathways, one of those chi pathways, which, if it's obstructed, will often present cardiac symptoms, but it will also often present symptoms which are sensible within the wuxing, within those five phases. So it's not unusual to find someone who may present with, let's say, atrial fibrillation, which has begun recently, that has struggled with joy at times in their life prior to that, or has had difficulty in the summer heat. These are not symptoms which would be seen as precursors to a cardiac arrhythmia for a cardiologist, say, but they would for a traditional acupuncturist who would understand that those symptoms of lack of joy, of difficulty in the summer heat, are likely prodromes suggesting a disharmony in movement of energy within the system, which, if we address them now, may head off the development of some more difficult symptom, such as an actual cardiac symptom, later on. So acupuncture and Chinese medicine are most often practiced in a preventative way, if possible. What happens in the actuality of a practice such as mine is that a patient will generally come with an advanced symptom. After all, who wants to come have somebody put needles in them, especially in a system of medicine they might not have total confidence in? So they tend to come because whatever they have, as in Sandy's case, has not been efficiently or completely addressed by conventional medicine. And their doctor may say, I really can't do much for this. Maybe you could try acupuncture. As I have said many times to many of my physician colleagues, if they're successful in helping 90% of the patients who come to them, my practice is comprised mostly of the other 10%. It's challenging, but it's very satisfying. But if that means that I'm successful in helping 3/4 of the patients that come to me, well, that's a 25% failure rate. That's something I have to live with. But that 25% were not helped anywhere else. That's 75%. So that's the way it is. But then after a patient comes to me, and let us say, again, I picked a symptom at random, they're coming for headache, they have chronic headache. And if we're successful in resolving the headache problem, or it becomes much less of a problem than it used to be, they're likely to recognize, treating in the holistic model of traditional Chinese medicine that I've been explaining, that other things which perhaps they haven't even discussed with me feel better as well. You know, I never told you that I had difficulty sleeping. I only told you about my headaches, but since I've been coming to see you, I'm sleeping much better. Or I have more available energy. Or my general happiness set point seems to be higher than it used to be. Or I'm just not as worried. I don't perseverate around things as much as I used to. Could this have anything to do with what you're doing? Well, yes, it certainly does. So what tends to happen in many, perhaps even most cases, is now that people have discovered that the acupuncture has been so helpful for whatever brought them to acupuncture to begin with, so many other things seem to have benefited as well that they now will come for regular treatment, say every couple of months, or whatever the rhythm seems to be, depending on their age, their qualities of vitality, what seems to be meaningful for them, in order to sustain as close to optimal health as possible, along with all the self-care and everything else that they need to do to take care of themselves. Because we don't need a presented symptom to treat effectively. So that migraine patient now no longer has migraines, but my approach to treating that human being, as I said, I don't treat migraines, I treat people, and I try to foster a more functional harmony energetically within that person. If we're successful, I will be assessing that according to some of the diagnostic techniques which I've explained, and there are many others as well. For example, each time a person comes to me, as Sandy can testify, I read the radial pulse. But I'm not just reading the heart rate pulse. I feel the pulse in 6 different places on each radial artery, 12 in all. And in each place I feel the pulse, it corresponds to the functioning of a particular organ, system, meridian within their system, meridian of chi energy. So I'm balancing the energy within their system as a whole, which is what underlies the model of all of Chinese medicine, which, if we're successful, ought to have them feeling better, not only in their presented concern. Sometimes the treatment is more symptomatic and straightforward. So, for example, since Sandy mentioned it and even discussed his concern, I will therefore say that he had a particular neuromuscular obstruction which needed to be released. It wasn't necessary to address his particular presented predicament in a grand holistic scheme. Symptoms can be treated locally when they need to be. But I would always check the pulse thoroughly when he came, as well as observing all of these other parameters, because otherwise I could run the risk of addressing the localized symptomatic problem and destabilizing his system as a whole. That's the risk. And that's the risk, I might say, of entrusting yourself to the care of someone who only practices symptomatic acupuncture and is unaware of, as people with short course training might be. They won't be licensed in Massachusetts, but for example, some physicians get intrigued by acupuncture and with all the best of intentions will take very short courses and attempt to render acupuncture in a very narrow focused symptomatic way. Sometimes that's helpful, but since they're not aware of how to assess the effects of what they're doing on the system as a whole, there is a risk they can destabilize the system in ways that they wouldn't even be aware of. For a margin note, physicians have an umbrella license and can practice any modality, any therapeutic modality they may wish. An acupuncturist is trained in Massachusetts. We have several years of postgraduate training, and clinical training, and then you sit for a very rigorous examination to acquire a license to practice just acupuncture. And the same thing, if you wanted to see a chiropractor, they have their several years of chiropractic training and clinical training, and they're licensed to do that skeletal manipulation, which they do. But a medical doctor can perform skeletal manipulation if they wish, even though it's not part of their training. They can offer you counseling, psychotherapeutic counseling, even though it's not part of their training. They can practice acupuncture if they wish, even though it's not part of their training. Very few would undertake to do those things because they have integrity and they understand that if they want a specialist, somebody should be sent to someone who has this training. But they can. And with acupuncture, sometimes they will practice a symptomatic approach to acupuncture. Very few do this anymore because they've learned. and they tend to refer to a licensed practitioner. But there is the risk. The risk of that is that too isolated a symptomatic approach can create problems elsewhere in the system that someone without complete training would be, oh, hello, Pooch. Hello, beautiful doggy. Someone without complete training would be unable to assess. So I think I'm going to take a break right now and see how I baffled you. And whenever I give a talk and there are a few questions, I feel that I've really baffled people. But I really do welcome any question about health problems, what acupuncture can treat, what it can do, any of the sort of cosmological perspective that I've tried to offer you, or anything else at all, except your individual personal problem. If you would like to ask questions about that, all kidding aside, please feel free to call me at my office. As I said, although there can be a wait for an initial appointment, I can often counsel you on the phone as to whether I think acupuncture might be helpful, and I can happily refer you to other people who may be able to accommodate you in the region. Happy to hear from you there privately and confidentially. In this forum, let's keep the questions more general. So thank you for your attention, and now I'm happy to receive your questions.
Okay, so you can either raise your hand and I'll see it, or you can use the, as you see in my face over here, the raise hand icon. You can do it either way. Larry? Okay, Larry,
Hi,
Yeah,
Larry.
yeah, can you hear me okay?
You bet
yeah,
I can.
Yeah, good. I'm dodging a little bit of sunlight through my window, so bear with me. I love your presentation. It just gets me thinking in 100 different directions. And I get a total sense of how important whole system is. Um, I was listening intently as you were kind of connecting the five seasons to the law, the five elements to the emotions, and it's hard to get it all, but it kind of gives a real quick hit essence of there's a lot going on here that over 5 decades of time it rolls out of off your tongue beautifully. Um, I'm kind of curious, uh, is this a profession very much analogous to chiropractic that had to fight its way with the Western medicine, with the various professional groups? Did they try to keep you away, or has that sufficiently changed finally over the years and it's way more accepted? Insurance world involved in understanding it? Do you follow kind of how it's integrated into the United States anyway in terms of our system?
Sure. Thank you. Good question. I've had this question since my very early years in practice. And I can tell you, in almost 50 years now, I have had zero conflict with the orthodox medical profession. Nothing. On the contrary, any conscientious physician lives with some very difficult secrets. The first is that 100% of their patients die. Uh, the second is that many of them may live a long time, but there are many problems that they cannot resolve. Maybe some they can cure, some they can't, some they can manage efficiently, some they cannot do much for. And so any credible physician is delighted if there is an alternative that they can offer to a patient whom they cannot help that may be helpful. What they want to know is this a credible alternative? Is the practitioner a charlatan or not? But conflict, as I say, nothing. In addition to that, it's entirely different from chiropractic. Acupuncture established itself quickly once it came into this country through research. As I said, if you just go to NIH website and keyword acupuncture, you will see thousands of studies. And these are reputable, clinical, double-blind, peer-reviewed studies of all the conditions that acupuncture is effective at helping. Now, even though, according to the parameters of traditional medical science, we don't know how it works. Long pregnant pause there. We know how it works according to the parameters of Chinese medicine. I know how to do what I do safely and effectively. I can explain how what I do works according to traditional Chinese medical theories. But in terms of, say, and so we know that acupuncture affects nerves. Okay, that's been demonstrated. But how does that particular treatment quell that headache? That's still largely unknown. Physicians are not troubled by that, to perhaps many people's surprise. We don't know how 50% of the drugs in the medical pharmacopoeia work.
Right.
We know how to prescribe them safely and effectively, and how to mitigate the side effects of them and so on, but we can't tell you exactly how gabapentin affects the nerves. We know that it does. Seems to improve many neurological disorders, so neurologists prescribe it. We don't really know how it works. So it's not troubling to a physician that we don't have all those answers. We're beginning to piece together some of it. But the fact that it works, that it's been demonstrated to work without side effects, safely, for many conditions that conventional medicine does not address effectively, physicians are happy about that. Just as Sandy, I'm sure, can testify to that. You go back to your doctor and say, you couldn't help this problem. I saw an acupuncturist. He resolved it enduringly in a few treatments. They don't say, well, don't you think that's quackery? They say, what's the name of the acupuncturist you saw?
I can tell you, Jonathan, that's exactly what happened to me. Word for word, it's exactly what happened.
Yeah, thank you. So that's what I've experienced throughout my career. Uh, Now there's a various levels of openness. Some physicians love acupuncture and we consult all the time. Others are more conservative and so on. That's true. But unlike chiropractic, and you're right, has had a lot of conflict with the medical profession. And I think that is largely because of exaggerated claims that were made for it. If the spine is aligned, no one will ever be sick again. And no chiropractor would tell you that today. But 50 or 80 years ago, you would hear that sort of thing being said. I think Palmer, J.D. Palmer, I guess, was the name of the person that developed this spinal manipulation technique. And he would make claims like that. And so the exaggerated claims, but once chiropractors say, this is what we can do, this is what our training is, it helps these conditions, it's not appropriate for those conditions. We know what our skills are and our effectiveness, we know what our limitations are. We know when not to treat. Once that became more established, I think medical physicians became much more accepting of chiropractic. Because they see chiropractors themselves, but it started out badly as a kind of competition. And anyway, I could go on about this, but not with acupuncture. Wide and broad acceptance. Thank you, Larry.
I have a question.
Sure, go ahead.
I don't know how to
Yeah.
use the little hand, sorry.
It's okay.
So
Very interesting presentation, thank you.
well, thank you.
I'm sort of curious in a larger sense about what Eastern medicine has to offer, traditional Chinese medicine. So is there a toolbox, and acupuncture is one tool in the box? Is there
Perfect. Thank
yoga, Tai Chi, or?
That's perfect. Yes. Are you done? Is that it?
Yeah, that's kind of the essence.
should
I
have
thought
covered
maybe
this,
you
yes.
could just elaborate on that.
Acupuncture is a primary therapeutic clinical technique. Another one is Chinese herbal medicine, which I also practice. Very different from Western herbal medicine because it's practiced according to the same diagnostic parameters as I was explaining acupuncture is. So for example, let's say you have a stomach ache, you have indigestion. In Western herbal medicine, Native American herbal traditions, European traditions, various indigenous traditions would tend to prescribe an herb like chamomile, for example, which is useful for calming the stomach. Chinese medicine would say, does the stomach feel hot? Does it feel cold? Are things moving too quickly and need to be slowed down? Are they moving too slowly and they need to be speeded up? Is it worse in the hot weather or the cold weather? Is it accompanied by headache or not? Do you develop nausea or not? Does it affect the bowels? Are the bowels too fast or too slow? And I could go on with 100 other questions. And then, once we feel we have a grasp of what the disharmony is, which is yielding this particular focal symptom of indigestion, an herbal formula is compounded, which typically will have 12, 16 or more herbs in it. And depending on what we find, there may be herbs which warm the stomach. There may be herbs which cool the gallbladder. There may be herbs which stimulate the bowel. There may be herbs which calm grief. There may be other herbs which help the particular herbs you put into this formula to interact well with each other. So it becomes very complicated. And then that whole pattern is what will be addressed, not take this herb for your stomach. In the whole history of Chinese medicine, a typical Chinese pharmacy uses about 400 different herbal ingredients. There are thousands, but realistically speaking, 400, and of that 400, 100 very often. Never are they prescribed one herb at a time. I'll repeat that because it sounds like hyperbole. Never. So in the West, we may say, I'm taking ginseng for energy. In China, you would never do that. Well, I can't speak about contemporary China. You know, they may because so much has been westernized. But in traditional Chinese medicine, you would never do that. If you need energy, why don't you have enough energy? And then all the questions are asked. And then a formula might be compounded, which includes ginseng as an ingredient. But ginseng could be precisely the wrong thing for a particular person. So yes, Chinese herbal medicine is another great branch of Chinese medicine. Also, yes, meditation, very important. I talk to probably half of my patients about meditation and forms of meditation, and do they meditate, and are they interested in it, and how could they possibly learn it, and how might it be helpful to their particular concern. Also, what's called Qigong, which is the movement of energy, and there's internal and external Qigong. Internal Qigong is really using the mind to influence the systems of the body, to contact and move energy within. External Qigong is using movement, like Tai Chi, you're probably familiar with, is a form of Qigong. There are many forms of Tai Chi, many forms of Qigong, another great branch of Chinese medicine. Massage also, there are different kinds, some of it is called Tui Na. Different forms of massage therapy are an important part of Chinese medicine. This is traditional Chinese medicine, and I'll take a question in just a second. Also part of traditional Chinese medicine were different forms of surgery and so on. But contemporary medicine is so much better at that. So, you know, in traditional Chinese medicine, that's fallen away. I suppose some traditional Chinese practitioners somewhere, not in this country, might do that. But here, if someone needs surgery, see a surgeon. So is that helpful?
Okay.
Yes, thank you. That's very interesting. Yeah.
Okay, I see, Di, you raised your hand.
Maria, yeah.
Yes, hi.
You're muted now. There you go.
I'm muted now.
No,
I
you're
can
okay
hear
now.
you.
We can hear you.
Okay. I have a question about the frequency of treatment. And I've been told that the more frequent the acupuncture treatment is, the more effective it is. I don't know whether you can speak to that sort of in the abstract.
Sure I can. Thank you. It's a very good question. Naturally, it depends on what we're treating and how severe it is. And a very acute problem involving extreme pain, or some other acute presentation. For example, acupuncture is often used in the treatment of addiction. Well, if you present a major addiction, a major narcotic addiction, you may need treatment several times a day at first.
Mm,
I don't see those kinds of patients, but that would be the most extreme. Someone else may come to me with something which has just arisen, and I may treat them just once.
okay.
That would be the other side of the spectrum. If
Mm,
someone comes with a chronic condition, you know, mm, I keep using migraine, so I'll go back to it. I've had migraine headaches. I tend to get them every few weeks. They last 3 days. They incapacitate me. It's been going on for 10 years. Now, recalling that they will have their own individual approach to treatment. There won't be sort of a particular formula, but still, I might want to see that person once a week for several months in order to undermine that pattern and shift it. And if we're making good progress, what would good progress be? Well, the perfect response is I don't have migraines anymore. If that happens, we're done. But if they say, "Oh, my migraines are as frequent and terrible and awful as they ever were," then we're also done. We don't go on and on if we're not seeing some benefit, or if something is beyond the reach of what I can offer. But more commonly, I would anticipate someone would say, after, say, a couple of months of weekly treatment, I'm actually feeling much better now. I did have a headache a couple of weeks ago, but it only lasted 2 days, not 3. It was much less severe and there was no nausea. I would probably continue to see that patient. The objective would always be to gradually extend the intervals between treatments.
mhm,
No, seeing them no sooner or no more often or less often than I need to. So we go to every 2 weeks, every 3 weeks, once a month, and so on. The idea always is to get to independence of acupuncture as rapidly as we can without
mhm,
compromising the benefit.
mhm,
Now, a person may get to a point, as I alluded to before, where they say, I'm not having headaches anymore, or they're much less frequent, or they're much less severe, or they're much less of a problem, and they might want to see me, let's say, every 6 or 8 weeks on an ongoing basis, because they've recognized the benefit of that. That would be up to them.
mhm.
Did I get to what you wanted to hear?
Yes. Mhm. How about, do you ever do treatment more than once a week?
Again, if it was an urgent situation, yes. Or if there was a very rigidified pattern in the system, or they're in great pain,
Mhm,
or there's a great temporary urgency. For example, acupuncture is often used to mitigate the side effects of chemotherapy for people having treatment for cancer. And if they're having extreme symptoms with great nausea and great debilitation, I may see them twice a week, at least following an infusion or that kind of thing.
mhm,
So it's always whatever is needed for that person. It's a very versatile system. But
mhm,
there is in Chinese medicine something we call the law of least action. And some of the tradition I'm trained in really comes out of Japan, because what we call Chinese medicine is really Asian medicine. It's practiced all over China and Taiwan at this point, and Korea and South Asia and Japan and so on. And there are different sort of flavors of it in different places. And the Japanese tradition, in many ways, values doing more with less. You're probably familiar with haiku poetry, and that's a very important emphasis in much of Japanese culture. So we have
mhm,
what we call the law of least action. And what
mhm,
that says is if I can do something with the placement of 8 needles, I won't use 9. And if I can use 1, I won't use 2. And if I
mhm,
can use none, I won't use 1.
mhm,
In the same way, if I feel that once a week treatment is optimal, I won't see somebody twice a week.
Mhm,
And if we get to the point where once a month is optimal, I won't see them twice a month.
mhm.
Always trying to do, after we're encouraging the natural healing processes within a person's system. And that's what's really working the cure.
Mhm.
I'm, watering your plant every day is not better for it. But watering it every 2 weeks may not be enough. But in
Yeah.
any event, all we can do is water, and it's nature that's growing that plant.
Yeah.
Okay,
Thank you.
Any
Thank
more
you.
questions?
Saren,
Sarah, yeah.
you got to unmute, Saren.
We're waiting for Saren.
Saren, you're muted.
Do you see your mute
Oh,
button in the
she's
lower
there
left
you
corner?
go.
Okay.
Okay.
There you
So,
are.
yeah, I have a general question about acupuncture. I have heard that in China, they do some operations without using any anesthetics, with just the role of acupuncture. So, is that a very common practice, or is it some fake information I
True,
have?
I'll speak to that. So when I was doing a clinical residency in Shanghai many years ago, we did this. So I have that training. And with very little acupuncture, we were able to participate in abdominal surgeries, appendectomies, cranial surgeries, where the plates of the skull are removed and tumors are removed from the brain with the patient wide awake, fully conscious on the table. Sometimes it's very useful because, for example, during the surgery, the surgeon can ask, can you move your left foot now? Rather than waiting for the result later. Also minor surgeries. Acupuncture for analgesia, as it's called, temporary diminishing of sensation. Very common, not complicated. In this country, almost non-existent. Why is that? And I can only tell you speculatively, but through my observation, when I was in China, American anesthesiologists would come to watch what we were doing, and they'd be enthralled and amazed and want to get back to their medical centers and begin instituting this approach. And when they get back to their medical centers, nobody knows how to do it. There are entrenched interests. The anesthesiologists are masters at what they do, and they know how to do it safely and effectively, and they don't know anything about this. If we bring Chinese trained acupuncturists over here, who's going to supervise them? In China, you have very sophisticated contemporary medicine practiced alongside pretty sophisticated Chinese medicine. So it became institutionally impossible to bring it into the American hospitals. Now, I was sure it would have happened long before this, but it hasn't. And by the way, I don't know how to do it anymore. That's not part of my original training. It's what I did in China. It's not part of what I have any practice in doing here. They don't call me into the hospital and say, we're doing brain surgery today. We hear you're a doctor of acupuncture. Would you like to come help us? They wouldn't ask, and I couldn't do it anymore. In fact, I couldn't have done it there if I didn't have skilled clinical supervisors that were working with me. So it doesn't happen here, even though, yes, it's highly effective. It has many useful applications. It is used in China quite commonly. Something like 90% of the abdominal and cranial surgeries are done with acupuncture anesthesia there, and none of them here. So not as though it's unknown, but it's just not happening.
I was thinking it may be being applicable, not for surgeries, but like I have a close friend and she had knee surgery, and then it was 10, 15 years ago, so it needs to have another one. unfortunately. So she's under so much pain. So, and of course, they give very strong pain medicines. Like in cases like that, would the role of acupuncture play a big role in it? Not giving medicine, but just doing acupuncture to control the pain.
Yes, that happens every day in the office of an acupuncturist such as myself.
Really?
Yes, it's very, very common. Patients all the time, they come, my knee is bone on bone, but I don't want to have the surgery. Can you help me? And yes, often we can. Because
Wow.
so much inflammation in the connective tissue around the joint. And acupuncture can often diminish that inflammation very directly. And people can often get substantial relief. So localized pain problems like that, and I should have addressed that sooner. Although Sandy could testify to that. That's something that we address in the office all the time. But
Well, this is not much widely known. So this is very enlightening meeting.
it's true. But again, people ask me frequently a question that a statement like that would lead to, don't I wish acupuncture was more widely accepted? From my point of view, as the first acupuncturist in this part of the country, when nobody knew about acupuncture, knew how it worked, from my point of view, it's been coming on like a tsunami. The acceptance that I've seen grow. I mean, there are tens of thousands of people in Western New England who have had acupuncture treatment, up from zero when I came here in the 1970s. So you are right. It could be more widely accepted and could be happening more, but it's developing very rapidly, actually.
Carmelina, you had a question.
Yeah. So, well, first, sorry about the dog. He's kind of like a Velcro dog. So if it's him and I only at the house, and I shut the door for him, he starts crying, and it all goes down from there. So sorry about his appearance. He's actually on Chinese herbs for one of his legs because we go to a holistic vet, and he has given him some Chinese herbs to avoid surgery, hopefully. So my question is, I know you mentioned that you're
Has he had acupuncture?
no, but he said that if the herbs do not work, then the next step is to try acupuncture. Yeah.
There's a great deal of especially canine acupuncture and Chinese herbal medicine used with animals now. But I'm sorry.
Yeah. No, it's okay. It's okay. I know you said, you are not receiving new patients, but I'm wondering, say for example, I hear this talk and I'm interested, and I just go out and try to find a good acupuncturist. What are like some things that I should look for to make sure that I find a good acupuncturist, besides of course that it's licensed by the state of Massachusetts? What are like some things that could actually give me the clue that this is someone, that is trustworthy and good at what they do?
Sure. Very good question. First of all, I do see new patients. I mean,
Okay, sorry.
I saw Sandy, of course, he was a friend, but so I
Okay.
see new patients. Sometimes there's a wait for an appointment, that's all. People can always call and ask. And, in some weeks in the office are busier than others. So if I can accommodate new people, I certainly will. But more generally, you want someone, everyone is licensed in Massachusetts, so everyone has training, and the training is considerable, and they've passed a rigorous examination. I like to say, if you have a superficial problem, I have a little pain in my elbow that started a few days ago, see any acupuncturist. If you have a more complex problem, or you have this problem in the context of complicating pathologies other than this, so you may have pain in your elbow, but you also have respiratory impairment and coronary artery disease and other things and so on. You're on various medications, or you have a problem that has been present for quite a number of years. You want an acupuncturist who's been in practice for at least 10 years. Because, we always say when you go to medical school or acupuncture school or whatever, every patient gets well on the blackboard. So you want someone that has an abundant experience. And 10 years is what I always used to say. Now I'm more likely to say 20. You want someone that has been dedicated to this practice for a long time, has had the opportunity to see a vast variety of people in a large census of patients. And you can look at a website and you can get that idea. You can also call someone up. You should be able to speak to the practitioner. I always say that that phone call is diagnostic for both patient and practitioner. Do I have a general sense of trust for this person? Do I feel comfortable with them? Trust your intuition. You have a choice out there. There are a lot of practitioners now. How often does someone go to a doctor and say, well, I really didn't like him, but I guess he seems to know what he's doing. I mean, you may have no choice, but it's a terrible situation. We've often been in that situation. No, you should feel a rapport, a confidence. You're placing your precious body, and permit me to say body, mind, and spirit, in the hands of this individual. Do they seem like someone you can be comfortable with? And do they have a lot of experience? And addressing the particular problem you have? Those are the criteria you're looking for. Take your time. Read websites, call people, talk to them, see how you feel. Or ask me. I am unabashedly honest about my colleagues. I will do things that physicians don't always do. If you called me and said, so I have to pick a random name that's impossible. So I would like to see the acupuncturist Harry Jones. What do you know about him? I might say, is there anyone else you might want to see? Or I might say, good choice. Brilliant. Wonderful, respected colleague. I would entrust my own care to him. I'll tell you what I think. But I'll ask you, well, why would you want to see this person? What are you going to be presenting to them? What's your concern, and so on. And then tell you what I think, if I can.
Thank you.
Okay, I think we have time for one more question. We're getting close to our limit. Looks
Yeah.
like, Larry, you're the last person.
Okay, I'll yield to anybody else if you've got a question. I'm not seeing any other hands. It sounds like a lot of the essence of the practice ties to, your reference to chi, to energy, to flow, and back to that diagram with the meridians. And I'm kind of curious, like, kind of like how does hypnosis work? There's a little bit of surrender to the practice in hopes that, yes, this is real. It's going to work for me. The meridians seem critical to the practice. Were these developed forever ago and they're still the same? Or is this one of those things that over time you've seen a change and there's more known?
Brilliant question.
Yeah.
Brilliant question. I'm going to give you a bifurcated answer. The first part is yes, long ago. But again, you have to look at the grand sweep of time. And because, and as I explained in the beginning, why this happened in China. So a particular doctor found that if pressure or the insertion of a needle at a particular point seemed to have a particular effect in a certain way, rather than that being forgotten as it was in prehistoric Europe, he would write it down, draw diagrams of it, and the book goes into a library, and another doctor 100 miles away or 100 years later was able to find out, well, if I use that point and this one at the same time, I get an enhanced effect. And very gradually, over millennia, through libraries and research, the entire system in the network was understood, and it is complete. But other points are still being used. We call them new points. So they're kind of outside that network, but in their context of contemporary medicine, where a neurologist might find, This point, this place, if a needle is inserted, that's not exactly where traditional Chinese medicine says a point should be located. But in this other place, I also find a clinical effect. Some of that is also happening today too.
Hmm.
So there is some evolution happening.
Hmm.
The final thing I'd say, may I go on for another minute or two, Sandy?
Sure, you'll have the last word.
Okay, well, the final thing I would say is that the system of Chinese medicine is evolving in many ways, because of its interface with the West, not just its interface with Western medicine, but its interface with Western psychology. We know today, we take it as obvious that our primal experiences in early childhood influence our character as adults. That notion was not known anywhere in the world 200 years ago. Western psychology, beginning with William James and others, and Freud and Jung and the whole development of our theories of the subconscious, have clarified that so much of how we organize our lives today is a consequence of our primal experiences. That understanding is interfacing with Chinese medicine today. And the notion of the psychodynamic effects of acupuncture and Chinese herbal medicine is expanding beyond what traditional Chinese medicine understood. I wish I could go on, but
Fascinating stuff. Thank you
I
so
will
much.
stop there.
Well, thank you.
Let me say, if I have the last word, my last word is thank you for your time and attention. It has been a pleasure today.
Well, thank you, Jonathan. Carlina, do you have a
Yes.
questionnaire available?
Yes.
Yeah, go ahead.
So when you click off for the meeting, there'll be a quick little survey for you to take, and we'd appreciate you filling that out.
Okay, I'm going to say my goodbyes. I
Okay,
accept.
goodbye. I'm glad it was
My
a
great
wonderful talk, and thanks everyone for coming.
Thank you, everyone.
Excellent job, Jonathan. Very well done.
Thank
Yeah.
you. Be well, everyone.
Thank you.
Bye.
Great.
Thank you.
Thank you, Carolina.
Thank you. It's okay. Thank you. Bye-bye.
Very
Bye.
glad to have you on board.
There you go.
Thank you.